Wes Streeting has suggested weight loss jabs could be offered to millions more people on the NHS in a bid to tackle obesity.
Yes, he was speaking at the Labour Party conference and the Health Secretary directly referenced the drugs as he hinted he'd make the treatments available to everyone who needs one, not just everyone who can afford them.
Take just one example today, weight loss jabs. The wealthy talk about how they've transformed their health, their confidence, their quality of life. But seriously, what about the millions who can't afford them? This is a return to the days when health was determined by wealth, when some had access to the best care money can buy, while others waited and suffered. And I say never again.
Well, the bill could be an estimated £10 billion in England every year. Is that a price worth paying to get on top of our obesity problem? Broadcaster Atta Jewel says the injections helped save her life, believes the drug would save the taxpayer billions more in the long term. But GP Dr Pasha Mukherjee says this is not the way to approach the obesity problem, doesn't get to the root cause. Good morning to you both.
Good morning.
Atta, did you pay for your weight loss jabs?
So I am type 2 diabetic. I have the Ozempic jab on the NHS and I am evangelical. It's literally saved my life. It's improved my quality of life, my mental health. I've lost 7 stone. I've actually lost 4 stone naturally, 3 stone on the jab. So I've done both sides and I literally think it's going to be a game changer for so many people. It's lowered the noise in my head in terms of food, and I think people don't understand food addiction. It's not about having an extra hobnob and wanting to be a snatch size 10. It's about disordered eating, pressing the reset button on your relationship with food, and it saved my life.
Dr Mukherjee, it is clear from what the Health Secretary said there, we cannot go back to the times when only the rich could get the best treatments. What he's saying is that the best treatment now to get your weight down is to take weight loss jabs. I'm sure he's not saying only that. He'd say exercise and good nutrition as well. But clearly the health department of our country is now saying this is a good treatment which should be available for all. And you say that's wrong.
Let's be honest, obesity tends to be much higher in lower socioeconomic groups. So it's not actually an illness of the wealthy anyway. And the reality is it's not just the wealthy that are accessing this drug, although, yes, there's definitely been a huge part of celebrity culture recently. But let's be honest, that this is a multi-layer problem in terms of what got a country like the UK to a 60% rate of obesity. We have to look at those demographics and those numbers and fix those problems.
As well.
And we know mental health is a big part of it. Every penny that is spent on drugs could go to prevention, towards, empowering primary care, empowering mental health services. And food addiction is a big part of mental health problem that we have in society.
Dr Mukherjee, I know it's a multi-layered problem, but this is a very good solution. So why not give people the solution and then deal with all the multi-layers of the problems?
Well, this is what I have a problem with. It sounds like it's an easy fix when it clearly isn't.
But
this
fix...
fix...
Atta lost 3 stone on Ozempic.
Yeah. So
that's quite an easy fix.
And I'm not saying that people cannot benefit from it. The people that absolutely need it should benefit from it. But let's look at what's getting them there in the first place. What I worry is that people are going to get reliant solely on this medication without having the infrastructure, and we currently don't already have the infrastructure to support.
What do you mean infrastructure?
To support the patients who are on these medications, we need to have nutritionists, an exercise plan, continuity of care with their primary care providers and various other providers. Patients can't even see their own GP. They have to repeat the story.
The jab is like an amazing tool. It is something that anyone who's been on my Instagram has seen my journey, and we are in alignment that it has to be a holistic approach. I've been working out, I've learnt how to eat properly with nutrition, and I've removed all the toxic things from my life. I'm getting divorced. I've got a great network around me.
You were definitely eating the wrong things before, weren't you? That was part of the problem.
It wasn't even a case of that because, I'm very educated. I've been in wellness and beauty. It's not about not knowing what to do. It's like saying to an alcoholic, drink a glass of water when you're thirsty. You would never say that.
You shouldn't, and you still did.
Exactly. It's about trauma, it's about shame, it's about all these different things. It's a coping mechanism. And as soon as... But what happened was the jab really helped me with the noise in the head. It just... I say it was like being a vampire. And when you want blood, you're just thirsty for blood, thirsty for sugar. And as soon as the jab, I wasn't thirsty for blood or sugar, and I could focus on myself. So I think it is a beautiful gift. The NHS, we have to protect. We are so lucky in this country to have this beautiful thing of the NHS. I think in the long term, it will save us millions of people going back to work, being productive, mental health crisis that we're in. I actually think it's a really good investment. Look at the lifestyle-related cancers, blood pressure, stroke. You know, my doctor said I'd be dead by 50 if I didn't do something when I was in my 30s, and I was first diagnosed with type 2 diabetes, and that really shocked me. And I think it's literally saving my life, and why wouldn't you want that for millions of other people?
I'm so happy for you that this has worked out so well for you, but it sounds like you have a great community, you have the education, you have social media, you have so many resources that a lot of people don't have. And one of the things we're talking about is food addiction. Food addiction actually runs in my family, so does type 2 diabetes. And we know that actually a big part of food addiction can also be underlying neurodivergence, autism and ADHD.
I have ADHD, but...
Exactly.
Yes.
So people with ADHD have a 70% higher risk of developing obesity.
So give them a jab and help them.
We don't even have the medication available for ADHD. There's hundreds and millions of people who are undiagnosed with ADHD and such neurodivergent conditions. They do not have the support. We need to prevent and focus on prevention.
Dr. Mukherjee, we've had a great response from viewers on both sides of the argument. Tracy, no, if people want to jab themselves thin, that's entirely up to them, not the taxpayer. Norma says obesity costs the NHS a fortune, both in the short and long term. It will save money in the long term.
It's a preventable illness, and we need to focus on that.
But we are spending tens and tens of billions because we're not doing enough to stop obesity. And we should do lots of things, fitness, nutrition. But if the jab helps us to save £100 billion, surely spending 10 billion on the jab is worth it.
It's a pragmatic approach, but these jabs are so expensive. I feel like this is only going to benefit the pharmaceutical companies and not necessarily society as a whole.
I think it is a very good investment. We are a community, we are society, and this is a great way to invest in who we are as a country and to keep us healthy.
I feel like we're going to be back here in 10 years. We're going to have millions of people who are not going to be actually able to tolerate this drug because of its side effects. And we're going to have people who are possibly going to stay on the drug, maybe come off it after a couple of years, gain that weight back, and it's going to be a revolving door situation.
The only yo-yo I had was when I wasn't on the drug. I've been on the drug. It's helped me to deal with everything that needs to be dealt with, and I think it's something that is a really beautiful gift.
And what happens when you stop?
Well, all the triggers that were there have gone. Like we said, it's a holistic approach, but it really helped me get... It's like an iPhone. You don't need one, but my goodness, what a life changer.
Do you feel the same way, Dr. Mukherjee, about statins? I mean, we now have huge amounts of money being spent by the NHS on statins.
Statins are cheap.
I know, but is that giving money to the drug companies, or is that saving money for the NHS?
We have to have a pragmatic approach.
I agree.
We have to think about cost versus benefit. This medication costs a lot and needs the full infrastructure, dietary, nutrition,
but it's saving lives.
Of care.
It's literally... You know what?
It's
I was
also
going to be
taking
told
lives
I'd be dead.
as well. We've had almost 82 people dead on this medication already.
We are being shouted at in our ears to stop this debate, but it's such a brilliant debate. You want it to go on and on and on, but thank you so much.
We asked you on X, should the taxpayer pay for you all to have the weight loss jab? Only a quarter of you said yes, it would be worth the price of preventing all of that obesity and overweight, and 74% agree with Dr. Mukherjee. No, we're not paying. Thank you both.
Thank you.
Very much indeed.
Thank you.